Coming out an hour ago from the time of this recording, the World Health Organization now invites MPOX vaccine manufacturers to submit dossiers for an emergency evaluation. Again, this coming out today, August the 9th, 2024, directly from the World Health Organization. Now, I'm going to be sharing with you the latest on this, as I shared with you yesterday evening that the United States is responding to the deadly new MPOX strain. They're saying they are trying to contain this before it spreads and becomes a bigger problem. U.S. doctors are on guard for the strain of the MPOX spreading currently in Africa, but they're saying it is spreading further. It is now becoming a continental emergency, and we're hearing the World Health Organization, the CDC, they're taking into consideration should this be announced as a global emergency, as we're coming off of COVID, and a lot of people do not want to see another outbreak, pandemic like we had 4 years ago happen again with monkeypox, as this is a new strain. But take a look at this. They're saying currently the risk to Americans who have not traveled to Central Africa remains low. They're trying to keep it that way. This is a deadlier strain of the MPOX as it spreads to more countries, raising officials' alarms. They're saying that this is even more contagious and deadly to children. And also, there's a lot of concern about our southern border being open and potentially people that have been to these regions just coming in and this getting into the United States or spreading around the world into another potential pandemic. Now, I'm going to be sharing with you directly the information coming from the World Health Organization and also the latest coming out on news articles. And as always, these are all going to be linked down in the description below, so that way you can click them, read them for yourself. I cite everything like a book report so I can hold myself accountable to my community, and you can see that it is the latest information. Now, if you appreciate that, do me a favor before we dive in, hit that like button. Just takes a second, helps out the channel a ton. Hit subscribe to stay up to date. It's totally free. Why not? And also, if you want to see the live update as I shared it with you as it came out, stick around to the end. I'm going to have some more news on that for you as well. But with that being said, you guys, let's go ahead and dive right in and get you caught up on the latest. All right, so first, let's get you caught up on the breaking news. This coming out directly from the World Health Organization, linked in the description below, about an hour ago from the time of this recording. WHO invites MPOX vaccine manufacturers to submit dossiers for emergency evaluation. The World Health Organization has today issued an invitation for manufacturers of MPOX vaccines to submit an expression of interest for emergency use listings, or EULs. So they're saying that this is on the brink of emergency, potentially global emergency, and they're saying all manufacturers of vaccines, we need to create vaccines at a rapid pace. Please let us know if you are interested. The WHO Director General announced on August 7th, 2 days ago, that he had triggered the process for an EUL of the MPOX vaccine given worrying trends in the disease's spread. There is a serious and growing outbreak in the Democratic Republic of the Congo, or the DRC, that has now expanded outside of the country. A new viral strain, which first emerged in September of 2023, has for the first time been detected outside of the DRC. Now, the EUL procedure is an emergency use authorization process specifically developed to expedite the availability of unlicensed medical products like vaccines that are needed in public health emergency situations. This is a time-limited recommendation based on a risk-benefit approach. WHO is requesting manufacturers to submit data to ensure that the vaccines are safe, effective, and assure quality and suitability for the target population. Granting of an EUL will accelerate vaccine access, particularly for those lower-income countries which have not yet issued their own national regulatory approval. Now, the EUL also enables partners, including Gavi and UNICEF, to procure vaccines for distribution. MPOX is a viral illness caused by the monkeypox virus, a species of the genus Orthopox virus. MPOX can be transmitted from humans through physical contact with someone who is infectious, with contaminated materials, or with infected animals. There are currently 2 vaccines in use against the disease, both of which have been recommended for use by the WHO Strategic Advisory Group of Experts on Immunization, or SAGE. Now, let's take a look at how the United States is responding to this, and also what doctors are on the lookout for, as they're saying this is not your typical monkeypox strain, and it is transmitted much more contagiously than we've seen with previous ones. Now, the U.S. responds to the deadly new MPOX strain. The Center for Disease and Control on Wednesday alerted doctors to be on the lookout for a deadly new strain of the MPOX that is spreading through parts of Africa, while U.S. officials committed $424 million to the Democratic Republic of the Congo, which is the epicenter epicenter of the outbreak, so the United States funneling over money to help out with the situation. The so-called Clade 1 virus is more virulent and deadly than the Clade 2 variety that caused a global outbreak in 2022. The CDC alert came soon after the World Health Organization director said he would convene an emergency committee to determine if the outbreak amounts to the public health emergency of an international concern. Clade 1 hasn't been found outside of Central or Eastern Africa as of to date, so they're saying it is currently still within the continent. But the CDC said that clinicians should be on the heightened alert for patients who have recently been in the DRC or to any other country sharing a border with it. MPOX, previously known as monkeypox, has risen by 160% in Africa this year compared with 2023. According to the Africa Center of Disease and Control and Prevention, while most cases are in the Democratic Republic of the Congo, outbreaks have been reported in 15 other countries. MPOX causes fever, chills, swollen lymph nodes, fatigue, and muscle aches, and can be deadly to young children and cause complications in pregnant people and adults with weak immune systems. Due to the limited number of travelers and lack of direct commercial flights from the DRC, the risk of Clade 1 importations to the U.S. remains very low at this time. Now, here's another article that came out yesterday that is showing that U.S. doctors are on guard for a strain of the MPOX that is currently spreading in Africa. The Center for Disease and Control and Prevention sent a notice this week to healthcare professionals to be on guard for strains of the MPOX that spread through parts of Africa. The announcement comes as the World Health Organization said that it is considering declaring MPOX a global health emergency. Clade 1 MPOX cases have been detected in nations such as Burundi, Rwanda, and Uganda. Previously, the Clade 1 strain was detected spreading in nations such as the Democratic Republic of the Congo and in Central Africa Republic. Now, the CDC said that there has been more than 22,000 suspected cases, with more than 1,200 suspects losing their lives in the DRC since January 1st of 2023, tied to the Clade 1 strain of MPOX. Between 2016 and 2021, the DRC averaged about 3,767 cases per year tied to the strain. The CDC notes that because there are limited direct flights between the U.S. and the regions affected, the risk to Americans who have not traveled to Central Africa still remains low. The U.S. health officials say that doctors should maintain a heightened alertness for possible MPOX for those who have recently been to the DRC or any country sharing the borders with the DRC. Now, in most cases, MPOX is painful but not life-threatening. Typical symptoms of MPOX include a rash, fever, headaches, muscle aches. In 2022, during the height of the worldwide outbreak, vaccines were scarce while demand was high. Federal officials worked to make 2.5 million vaccines available to the public, and today we're hearing that announcement coming out from the World Health Organization saying submit your dossier as we need more vaccines. New vaccines will be coming on the way, and they are trying to contain this and hopefully not make this a global emergency, but contain it to the continent and try to stop the flow of this outbreak that is happening with MPOX. Now, again, all of these articles that I'm referencing are going to be linked in the description below with the actual release coming out from the World Health Organization, so you can see it for yourself and share it with others that might be interested in this. Now, in addition to that, I'll keep you up to date with everything going on in the world, with potential war we're hearing happening in the Middle East, with the elections going on. I will keep you up to speed here on the channel. And if you want to see that live report, as I shared it with you yesterday, as soon as the article started rolling out, be sure to check out this one right here as I covered the MPOX in more detail. But like I said, as more comes out, I'll be sure to keep you up to date here on the channel. Thank you so much for joining me. I'll catch you in the next one. Take care. God bless. This is Steve.